Dalam training ini kita mendapatkan expert internasional, bukan hanya nanti untuk memenuhi kebutuhan dalam negeri, tapi juga bagaimana Bapak Ibu sekalian to achieve the highest standard of the IVD, international standard regarding to WHO pre-qualification and other standard which we can enter to the global market.
So another part of understanding your product requirements comes from what does the regulatory body of the different countries that you want to sell your product into, what do they need to make sure that you can get your test to market?
So here it's really looking at how could this test be used, what are the countries, and which of these countries in terms of market size, market opportunity, in terms of proximity and ease of us as a company to address this market.
Terkait dengan regulasi dan juga ada beberapa tahap di mana ketika regulasi itu kita akan membutuhkan survei untuk kebutuhan market, yang mana kebutuhan market itu adalah tugasnya kami dari tim sales dan marketing.
We have sensitivity, specificity, limit of detection, interferences, cross-reactivity, taste failure rate, precision, repeatability, reproducibility, and I'm sure that there are more. I just listed like the most common ones.
We moved from a bulk buffer bottle to a single-use vial. But by doing that, they introduced so many other possible risks to this product.
At the early stages, when we start doing development, you are trying to improve very fast to get results very fast, but it's not in a systematic way. But once you start formal product development, then you do the things like in a kind of a stepwise approach.
Terkait dengan desain, kita harus melakukan kontrol secara penuh, mulai dari proses awal mendesain sampai desain itu kita deliver ke proses manufacturing.
Ya, risk management system ini cukup kompleks karena banyak hal yang harus difikirkan, baik menentukan risiko suatu produk hingga mitigasinya seperti apa. Itu penting sekali.
Banyak sekali hal menarik dan dapat saya pelajari, terutama adalah bagaimana mengatur dokumen-dokumen yang diperlukan untuk proses regulatori produk IVD yang ingin dipasarkan di pasaran Indonesia.
It's really how you demonstrate and how you ensure that the products that you put on the market are of quality and are safe and efficient. And in order to do so, it requires a lot of documentation. It requires a lot of communication internally to have both the product development team, the manufacturing team, the quality and the sales team as well.
In all cases, independently if you have done the R&D or not, you will be the legal manufacturer. So that means you are accountable for the product performance and you have to comply with the regulatory agencies.
We sign the deals and then the product is done. We're doing the validations, but after some validation, we do not get the same result, the accuracy that they claim.
You have to sit with your partner, I would suggest you to do maybe this risk assessment together with them, so they also see you are trying to find the cause, not just blame them.
The locally made doesn't have to do the clinical validation from the start.
Not necessarily. So we need to see some evidence about how equivalent it is. There's been so much emphasis on local production since COVID that there's multiple manufacturers of pre-qualified products that are now going through exactly what you've described.